Play and activity for children and young people in hospital is not just a nice to have, it's an absolute essential part of their healthcare journey. It helps demystify the hospital experience. We use play as a language to engage children and their families to help them cope with what they're facing in hospital, which can be some of the most difficult times of their life.
So play is so important in healthcare for children. It's a huge part of teaching them about what they're going to experience and creating a positive hospital experience. And if we can support a child in having a positive experience, it means their future hospitalisation is going to be much more positive and a much better experience for them and the family. So as an imaging play specialist, we're supporting children to manage MRI scans awake. So since 2014, there's been a huge increase in being able to manage children to have MRI scans awake from the age of 4 and upwards. So we've developed 2 lists now. So from having just a few patients, previously we now have up to 14 patients a week managing Cerebro scans awake. We do lots of preparation and support and establish coping strategies, which is really fantastic because it means that they don't have to be admitted onto the ward. It's a longer admission time and often a much longer waiting list when those patients really need those scans.
I joined a team to support a dental service. So these are patients who are unable to have treatment normally or with support via gas and air. They've been referred to this service because it's the step before general anaesthesia. So they're going to have treatment through a cannula and it's going to be a mild form of sedation. I support that service and the running of clinics that we run every single Friday, and it's been very successful and is growing and developing all the time. And it's a service that enables these children to have the treatment that they require without needing a general anaesthetic. So it's good for the patients and obviously good for the NHS because it means one less patient on the general anaesthetic waiting list.
So in the rec room we have a pool table, we've got games consult, we have various activities that happen throughout the week, and we provide arts and crafts activities or any activities which the patients wish to carry out.
Being part of the play team means that you get to provide the young people a distraction, a sense of normality, and also give them a voice as well when they're feeling like they're not being heard.
I support teenagers and young adults on the ward. It could be through play and also supporting the families because it's been a very traumatic experience for most families and definitely the patients. So just to bring a bit of light in the situation.
I think being in hospital and having access to play certainly makes a difference to children in a lot of ways. Playing and having these nice, bright, colourful spaces is something that's familiar and it's enjoyable. It can make hospital seem a lot less scary. We expect a lot from these children, particularly with the treatments and procedures that we have to carry out. Actually being able to do that in an age-appropriate, fun, engaging way helps the children to understand, but also makes it a little bit more easier to understand.
Play really does make a difference. It makes what can be the most difficult times a little bit lighter, a little bit brighter, and we want to continue to do more. Thank you.